this is Blake. I'd like to share some information with you today, which may affect you less right now, or it may affect you more right now, but it has to do with insurances as you are getting older and the current healthcare climate in the United States. Fortunately, I had the good fortune to travel when I was younger, and so that when I reached retirement age of 62 and I had retired, the high cost of healthcare has not been quite as discouraging or disappointing to me in the one hand, because I at least was not saving my golden years for traveling, because I have had a lot of costs of medical care. What we have with our situation now is that I have a chronic medical condition called gastroparesis. This past year, 2 years actually, I've had a broken arm. I received the diagnosis of gastroparesis. I had a hernia diagnosed and operated upon. I had a bout of depression. So all these things have led to really high healthcare costs. My gastric emptying test alone was, quite a significant procedure to have done. I went into the hospital radiology department and I stayed there for 4 hours after eating a radiologic radioactive breakfast. They traced the breakfast as it passed through my stomach over the course of 4 hours. And after 4 hours, I still had 42% of the food remaining in my stomach. Usually there is only 10% at the most that remains in your stomach. Usually less than that, actually. It's oftentimes not even any food left in your stomach after 4 hours. Your food should be digested. So gastroparesis is the delay of your stomach emptying after you've eaten something. And it can be quite severe. People sometimes have to be hooked up to in some kind of specialized feeding tubes and things like that. I don't have it in a very severe way at this point in time. It can get worse, but I don't. But I've had quite a lot of costs associated with all my health care in the last 2 years or so. And I just wanted to talk a little bit about the healthcare climate. I think that one of the things that we found is that the out-of-pocket maximums that were instituted under President Obama through the passing of Obamacare, as it was called then. It's more Affordable Care Act is a more appropriate name for it. But after the passing of the Affordable Care Act, there were there were annual out-of-pocket maximums that were instituted. And the result of that was that the most you can have that you have to pay out in a year is given to you up front, so that you know when you're buying the insurance policy how much is the most you can have that you are charged if you get sick. Both the last year and this year, we've exhausted our out-of-pocket maximum. So that's kind of discouraging. And I still have a chronic condition, and I take medications, and I still have I had to have physical therapy for my arm after I broke it, and I had to have 6 x-rays and a cast, and I get treated for depression, and that's included, follow-up care with specialists. And I have a hernia operation, which was a 2-day stay in the hospital, and in and of itself, that alone was like a $50,000 bill. So it's very, very much on people's minds today, I think, the cost of medical care and retirement and medical care. And I just wanted to give you some information that maybe can let you know that this is what stands now as far as the state of the state of insurance in our country. Now, there are you can have a deductible and an out-of-pocket maximum that are not the same thing. For instance, you can have a deductible that's $8,000 and an out-of-pocket maximum that's $9,000. And by that, what they do is they charge you for your copays, continue to charge you for your copays and your coinsurance. as the remaining $1,000 difference between $8,000 and $9,000. So the figure to look at really when you are obtaining insurance is the out-of-pocket maximum. In order to get reasonable premiums, a lot of times people have to pay the accept a rather high out-of-pocket maximum. So I will come back again some other time, and I'll give you some more information about the costs of health insurance for elderly people. I'm not exactly elderly. I don't like to think of myself as that, but I'm not eligible for Medicare yet. My husband is on Medicare, so he is able to get the coverage that the government extends, and plus a supplemental plan that he has that's offered through his associations, his retirement plan. So that's what I wanted to talk to you about today. Thanks.